Excellent. So, to everybody who is here, welcome. If you're watching on the replay, I'm just gonna continue letting people in. Yes, so if you're here live, welcome. If you're watching on the replay, I'd love to welcome you as well. I'm Kimberly. I've got wonderful Anna here and Dr. Kanayama as well. Today we are going to be hearing from Anna, who is going to be sharing her incredible story. It is so inspirational. Anna, thank you so much
Thank you.
for saying yes today.
Thank
And
you.
just I just want to say thank you everyone for your flexibility and for bearing with us with our technical challenges. And, I've been
Mhm.
sick all night and yeah, so if I just, go on mute and disappear really quickly, it's because I'm not feeling that well, but hopefully we will be just fine. So I'd love to start today off by again welcoming Anna and just if you did get the email for the registration, you may have read a little blurb about her. But Anna, I'd love it if you could just introduce yourself, tell us about, a little bit about your life and your history, and then when you're ready, just delve straight into your journey with endo and adeno.
Okay. Well, hello everybody. Thank you.
I'm
Thanks
just
for
going
the
to
time.
request that everybody mutes their mics. Hang on one second. Okay,
Okay.
excellent. So then we can hear you well. Okay, sorry, Anna, go for it.
No, don't worry. So thank you everybody for being here, taking a little bit from your time to listen to what we have to say. I imagine if you're here today is because you either know somebody that might be going through adenomyosis or endometriosis, or you might be going through it yourself. So I'm here just in the hopes to be able to share a little bit of my story, and if I can help one of you uh, go through this journey with better tools, I'll be doing my job. So, as Kimberly said, I've been going through adenomyosis. Sorry, my language, right? So
You're doing
talking.
amazing.
I'll be talking maybe in Spanish at some point. So, apologize beforehand for that. So I've been going through this my whole life. I pretty much got my period when I was around 10, 11. And I remember that I had this really strong lower back pains. I had cramping, which usually is just, they always tell you it's just normal, it's just part of your period. So me, as in somebody that's always tried to be very athletic, I always tried to doing sports, running, karate, and doing different things. I always went through these phases of the periods where I have the cramping and the pain and IBS symptoms. But back then I didn't even know what that was, and I never got checked for it. I was like, it's normal, so just man up, like just put up your big girl panties and just keep going, just keep training, keep doing your thing. So I did one of the things that I did have was a lot of migraines. My migraines were like really, really bad, oral migraines, to the point where one side of my body, my face will go numb. I'll lose my feeling, I start tingling, and then I see oral like a prism in my eyes. I will only see half of people's faces. I will be able to listen to them. I know exactly what I wanted to express and say, but my speech was scrambled. So I couldn't speak well. So, and it was always that, like, we didn't knew what was going on in my head. So I kept going to neurologists and other things that were like, it's just heavy migraines. So we didn't knew. I just kept dealing with it my whole life. And then as I progressed and I got into, I started getting married, I did an injection to prevent, getting pregnancy. That it lasts, I think it was Depo-Provera.
Depo shots.
Yeah, it lasted like around a year, right? And I was like, okay, you should be fine. So at least we have a year of grace, and not having babies right away. So, but that year was horrible, horrible for me. My hormones were like out of whack. I got all over the body bloating, and the headaches were like consistent, not and it fluctuated between consistent headache and migraines, and I just did not feel like myself at all. And I was like, I can't wait for this to wear out from my body, because I did not like it and I did not feel well. Um, then after that, I kept seeking. I always, after when I started getting to planning to get married, that's when I actually started going more to the gynecologist, because you want to make sure everything down there is working properly, right? So that's when I started going to them, and trying to find some answers. And they always told me, like, you have very small cysts in your uterus, but they're so small, don't worry. They won't cut. They shouldn't be causing that much trouble. That's not it. You're probably training too much. And the other thing, they always told me that in my ovaries, I had like a rosary, like a prayer rosary,
Oh
like
yes.
a, yeah,
Classic,
like the
like
cysts.
pearl of
Yeah,
sis.
exactly. And I had chocolate cysts, and sometimes I will go and the cysts will be there, and another time they will be gone, and I'll be like, but how is this? Like, how they come and go? So they really didn't explain to me what happened. Some women create them, sometimes they burst. That causes a lot of pain, but they didn't tell me any of that, so I had no clue. I thought it was just normal again. So pass another year, pass another 2 years, same situation, keep going, x-rays, MRIs, CTs, and you know how uncomfortable it is that you have to be going to so many different doctors showing your privates. Is not
Yeah.
fun for anybody. So I just have to be going and going, and no answers and no answers. And I just kept trying to do good lifestyle choices. I always been very active my whole life. I always tried to watch out what I eat the best way I knew at the time. So whenever I knew something wasn't working, I make the shift and I try to implement the new habits to my lifestyle. So I was always in that consistent shift and trying to find relief for symptoms that I really didn't knew, that I didn't have a name for them. It's just like, and you start thinking and doubting yourself. It's like, it's in my head. Maybe I'm crazy. And then another doctor once, it's like, maybe you have fibromyalgia or you have arthritis or something. And it's just like they keep giving me this weird diagnostic. And I'm like, I don't think I do, because I wouldn't be able to do all the things I do if I would have this. At
So
one
Anna,
point,
at this time, were you still so for anybody who doesn't, didn't read the blurb, you were a IFBB Pro athlete. That is like next level
yeah,
when we're talking about bodybuilding, like you would have pushed your body to the max to get to that level of athleticism. So how did this impact your athletic journey? I mean, were you just constantly pushing through the pain? Is that what you were
yes.
doing? Wow.
Yes, yes, I was consistently pushing through the pain, because remember at this point, that was around my 30s when I started competing in bodybuilding and training for it. And I always had the IBS problems and the cramping and all of that, and sometimes the bloating. But back then, it wasn't as visible as the last pictures I posted right before my surgery with Dr. K. By the time I went to have surgery already, like those few 3 months, let's say, right before surgery, I was so done with it. At the beginning, I was so scared for surgery, and I really didn't want it. I was so scared, but I really needed the surgery, and it got to a point when I felt claustrophobic. I wanted it out of my body, even though I
Yeah.
was so scared. I was in so much anguish and pain. Sorry.
No, take your time. This is so what you've been through is like extremely profound, and you're so, like I said, your story is so inspirational, and I'm so grateful that we get to hear from you, because it has just been um like I said, it's the most advanced like case of adeno I've ever seen. And you did get, when you mentioned the 3 months prior to surgery, are you talking about the 3 months before this recent surgery?
Yes, yes, because I had a previous surgery before,
Yeah, do you want to
in
share a little bit
2007.
about that and the findings then?
Yes, yes. In 2017, my symptoms, I had stopped competing by then. Uh, but the thing is that I had to go back a little bit. When I
Sure.
was competing in fitness, right? I always noticed that it was really hard for me to like get, my waist down. And even one of the judges back then, he told me like, was that, I see there's something that's not supposed to be there. And I was like, I don't understand. And no matter how much diet and how many waist slimmers you use or creams or anything, I was like, I don't know. I'm just trying my best, but there's a bulk that's not supposed to be there. So whenever I was on the stage, I had to be like sucking extra hard and posting extra hard to hide it. And whenever I had to do presentations and doing stuff, I would always be like, oh my God, but I don't get it. I'm skinny. I have muscles. And like, what's going on?
So your adeno bulk was very visible when you were super lean because your uterus was so large. Yeah.
Exactly. Like you notice girls that were at around that same weight and everything, measurements and everything, and their waist would look a little different, even though my waist looked tiny at that time. It was very different. But again, since I was so thin, you didn't know. And I never mentioned stuff verbally to other people on social media because I always had that in my head, like, how am I gonna be complaining about that? I have a little baby bump there when I know there's other women that have it worse. So I'm minimizing always my pain, my symptoms, and myself because I'm worried about that, and I know how other women have it worse, and they might have more ability. So I never thought like I can't be complaining about this on social media or telling people because other people might look at me and they're like, but you look healthy, you look fit, like, which is the same reaction I got from doctors when I went. It's like, but you're already fit, you're young, just keep doing what you're doing. Or on the other hand, it's like you're gonna have to stop training because maybe you're training too much. So it's like in one hand it's like stop what you're doing, in the other hand it's like keep doing. So it's like F this, I'm just gonna keep doing it, and when something explodes, but then they'll believe me. So you just keep pushing, which is what I've done all my life. So I think the time that I was competing, I was under a lot of stress, and I was like, since I had to be traveling and the meal prepping and stuff, and that endo and adeno, when you're any chronic illness, actually, if your body's in a consistent stress state, it makes everything worse. So I started getting joint pains too. My migraines got worse. At some point, I remember I got like 5 migraines in a span of like 2 days. It was like one migraine came, it went down, another migraine popped up, and it was horrible. So it was like, okay, definitely something is not right. So that's when I got to the doctor that they might perform my first surgery in 2017. My symptoms had gotten a lot worse. My bum was a lot more visible, even though you can see me shredded and I look super healthy to everybody. My bleeds have gotten super heavy. And then all of a sudden I started getting these hard, deep pains around my, how do you say, like really low in the uterus. And they take my whole vaginal and the whole back part. That's like the whole lady part. I don't know how to express it in English well, so I'm trying to. But everything, like the pain was so hard. I was going from my bed. I stood up. I was going into my bathroom. As I was gonna sit down, all of a sudden the pain was like, I don't know, like if somebody stabbed me somewhere down there, and I just froze. I was like, what the heck? Okay, definitely something is not right. So I started seeking for more help. I started getting also incontinence while I was sleeping, which I've never had before. And I was like, okay, where is this coming from? Like, I don't get it. So, and when I checked, and I had to not fight, but I had to appeal with that doctor in the same appointment, because she was about to dismiss me at the end of the appointment already. She's like, well, I'll see you follow-up appointment in another year. And then I'm texting with my husband, and my husband is like, what? And I'm like, yes. And then he's like, but did you tell her about the endometriosis possibility? Because we were researching, and endometriosis popped up to us, and the symptoms correlate. So I was like, I told her, and she's like, but do you have this? And I'm like, doctor, that's the first thing I told you when I came to this appointment. So she didn't listen to anything I was saying all the time. And I was like, so then she saw me and I started crying. By then I couldn't hold anymore, and the emotions were too much. I just started bawling my eyes out, and she saw the desperation in my face. And that's when she said, like, okay, come next week. We're going to perform another test on you. It's a little more invasive, but we don't need to go to surgery. So they performed the test in there. And that's when she said, okay, definitely you have some big cyst going on there, something, and this is not right. The options is like major surgery, or we can do endovaginal surgery. And then she did like and I said yes, because this was the less invasive, and I still wanted to try out for having children, because at this point I'm 30 something and nothing had happened. It's not like I was really like preventing it either, but we're like, oh my God, like what's going on? I let your will be and nothing has happened yet. So that's when we started like noticing, okay, definitely something is not right. Because I'm already 30.
Actual procedure that she did?
I'm not exactly sure how to pronounce the test, the procedure, but it was like she went vaginally, and like the lining of the uterus. There was at that time it was like 3 masses, and all she did was like with a laser she cut, and she created the lining, the tunnel, and that's all
Dr.
she
K,
did.
what would you describe that? Is it like removal of fibroids?
I'm not sure. It could be endometrial biopsy or hysteroscopy.
Is
Myomectomy?
Just put the
hysteroscopy.
camera inside through
Yeah,
your
yeah.
vagina.
It was like a hysteroscopy something,
Right.
and she took a biopsy from it, and that's when the biopsy results came, and they showed that it was adenomyosis. So that was the first time I've ever heard of adenomyosis, and I was like, and then all she told me, that don't worry, like that's like they call it, I think it's like the evil cousin of endometriosis. And I'm like, oh, look at me. Like, yeah, we have to go all out. So nothing, like from there, I had relief after that surgery. I felt a lot better after I recovered from the cramping from surgery. I started feeling a lot better, started training right away. Then at the year mark, the symptoms got worse than before. Heavier bleeding, the cramping was out of the charts, the belly bloating, and I started getting allergies and sensitivities and to foods and all that stuff. When I went again to the same doctor, she checked me again, and she was like, oh, whatever I took from you a year ago, you already came back. And it's not only back, it's like even bigger than before in a year. So, and then from there, she said like, okay, I cannot treat you anymore. This is out of my field of knowledge. I need to recommend to you to another doctor, because you still want to have children. In my case, I will just recommend hysterectomy, and that's it. So I'm like, okay, well, that's not the option at the moment right now. So we went with another doctor, and from there it was more tests, more. Okay, we can't do anything at the moment, and then pandemic hit. Yeah. Pandemic hit, so you know how that was for everybody. And I don't know what happened to the pandemic, but symptoms got even worse through pandemic. Even though when we were locked down, I don't know if it may be the added stress from all of that was going on. Also, when I was in the pandemic, I was doing a lot of live workouts with a friend of mine. He was doing a yoga part, and I was doing the live workouts. So I was like every day putting workouts out there, but I was also putting more stress in my body, which obviously I believe probably that was like a little bit like fuel for the masses to probably grow more because of so much stress and cortisol. And from there, I started seeking again another doctor, another option, and I went to like two more doctors. I had to go to a cancer colorectal surgeon so that he checked me. They did a colonoscopy, and I had like 2 colonoscopies, and they said everything was fine. They sent me to another gynecologist, and the same thing. It's like, okay. Another one was like one of the endo experts in Puerto Rico. When I went, he was like, okay, but you have the war of the galaxies inside your uterus. He tried to say it like it's in a funny way, but I was like, no. This is not funny for me right now. You know, it was like a really bad way to try to be jovial in such a deep topic for me. So, and that was the most known doctor we had. I know that we had here, and I was like, okay, I need to seek help. And my husband was very supportive. It's like, okay, let's go outside, let's find somebody else. And I've been following Dr. K for years. I think actually since the pandemic days. And we've been following him, and we learn a lot of information from his posts and other patients, and how other patients share their stories. And that's actually when we started like trying to reach out to different doctors in New York. We went then in December last year, I had another health setback. I ended up in the ER. Out of the blue, I started getting like a pain, like if somebody was like scratching my insides, and the belly got bloated, and it was so bad. And all of a sudden, bouts of diarrhea, and I felt so bad. And when we went, it was like apparently I got a sepsis. They don't know if it was food or if it was something else.
Yeah.
And by the time I was in the ER, my hemoglobin started going down, my platelets were going up. Really. So, and they're like, we need to leave you. You're gonna have to be hospitalized because we need to wash you. And they did CT scans and stuff. And when they did, they had to do blood transfusions in the meantime because my blood gets just going down like that. So they did two pins of blood, and the CT showed obviously what I obviously had. Yeah. And the doctor's like, okay, you have sepsis, you need blood transfusions, but you know you have something there in your uterus, right? And I'm like, yeah, I know. I just didn't knew that how much bad. And then from there, I mean, you've seen in my stories, I don't know if you saw a video that I put of a whole bunch of images, selfies that I took over time of my belly.
Yes, that was incredible to see.
I want to say that one of the things that helped me a lot to finally get a diagnostic and show and get to finally, what it was that I started documenting everything, so that when I went to doctor's appointment, it wasn't anymore like, oh, no, but I need to see it, or no, come next time. So I was like, no, like, look, this is my bleeding. Look, I got this allergy. Look, I got this nosebleeds. I had to literally become my own advocate and started making I have a big file of every time I went to the doctor's appointment, and doctor knows I went with a big bag with all the files and everything. I look like an old lady with a file. So, I mean, but I don't care, it was like, I need to do something, and I need to get to the root of this, because this is my health, and you know how hard this journey is, and how alone sometimes we can feel. Absolutely. But when you know that you can do better for yourself, you refuse to give up. You refuse to get no for an answer. And I was just trying to, I was like, I need to find answers, and I know what I want. And I had not giving up at the very end, but I was like, okay, if I need to take everything out, well, then I will be fine with it. But if there's still a little glimpse of hope and something can actually be done. So when we went to New York, I saw 3 doctors. 2 of them said, let's take everything out. This is way too risky, because it was so big, my uterus, like Dr. K said, it was like the size of a 6-7 month baby.
How big was it, Dr. K? Like in terms of like size wise?
It's the size of a good sized baby. So it's up to here, almost like your stomach right below diaphragm level. So it is so big. And her adenomyosis uterus is literally hitting on her spine. So there's literally no space left inside in pelvis. Posterior cul-de-sac area is completely occupied by the adenomyosis. There's no space, and almost like hitting on the side bone, pubic side bone. Yeah. So everything is occupied by adenomyosis uterus. It's amazingly big.
Is that the first time you've seen a uterus that big with adeno, Dr. K?
No, I have seen maybe close to 20 patients like her.
That big. Oh my gosh.
Yes. And
So
I saved the uterus, all of them. Yeah.
that's incredible.
But it's not easy. Very difficult.
Oh, yeah, and I'd love to talk about the surgery too. But Anna, did you feel like short of breath or like breathless and like compressed and those
Yes.
type of symptoms too?
Yes. Actually, before I got hospitalized, that year, that end of that last year, we were training because we were trying to run a marathon. And when I was training and running, I always felt like this need to like, like do like a stretch while I was running so that I could like gather a deep breath. Because otherwise, sometimes it felt like it was like shallow breath. I was like, and my heart rate, I mean, it was fine. I was like, but I don't feel tired. I feel like I can just go and go. But sometimes the cramps and the taking breath was like very overwhelming and kind of claustrophobic like, because again it feels like if you have a volleyball there and you're trying to open up. And I did breath work, I did Wim Hof breath work, I was doing ice baths with my husband. uh, I was trying to do stretching, a lot of mobility, yoga moves, and stuff. I tried to open up my hips to find any type of relief for everything. So it was really, really hard and overwhelming. But one thing after surgery, though, that I noticed the most different is my opening of the lung and diaphragm. And I feel so, I mean, compared to how I felt before, because obviously I'm not like super normal either. Uh, my uterus is never gonna be like a normal uterus, but it's way much uh, free and empty. You know, the feeling that I have now in my stomach. You know, like
Yes.
now I can feel like I can breathe. And even though I'm still healing, I'm only like I'm gonna be 8 weeks now, so it's pretty good. Like I was already telling Dr. K in my last appointment, like if I could start working out, because I'm already feeling the energy, and I want to do more, but I know I'm trying to be a good patient, Dr. K. So I'll behave, and I'm trying to wait out the time so that I give my body the proper time to heal. You know, so you need to
Yes.
be obedient.
And can you tell us a little bit more about, you mentioned that you went to New York, you saw 3 doctors, 2 doctors said it was too risky and to just get a hysterectomy. Is that right?
Mm-hmm. Yes, yes. I mean, they were nice. They were top professionals in their field, also just as Dr. K. They were like just like every other doctor told me. It's like we wish you could have come to us sooner. We could have been able to do something sooner. But obviously, that wasn't the case, because it took so much of my life to be able to even get a name, to put a name to what was. That was and having that figure out. So, but they say it's like it was too much, and they said like the risk was like, if they could try it. It's like, we could try if you want, but like we're not responsible, And they're like, but like if you, even because of your age, and even if you do get pregnant, your uterus could burst. And I got really scared because of that. So, but then I went to Dr. K, and he gave me hope, and he was very straight up with me. He was like, "You are a hard case. It is a difficult case, and I knew that already." But it's like, "But is this what you want? I can still try." And even to the last second, I told him, "I trust you. And even at the end you think you cannot save it, and when I wake up I don't have a uterus, I'll understand." At that point I already make my peace with the process. I was like, I need to like he even himself, he told me one of our phone calls, at some point you need to, if you do believe, you need to trust that things are gonna work out your way. So, and so far everything's looking good. So
Yes. So can you tell us, maybe Dr. K, can you tell us about the actual procedure, the technique? We've also got a question here asking if hysterectomy is the best option for adenomyosis. So I'm thinking you can kind of answer this question and talk about the actual surgery.
Yes. So first of all, adenomyosis, I think we really need to define correct diagnosis of adenomyosis. And many doctors' website and also even including some endo advocate website, they put a incorrect definition of not same as tissue inside the muscular layer of uterus.
Sorry, we're losing you a little
So
bit. You're cutting out. So
adenomyosis.
sorry, Dr. K. I think just
Oh,
where you're sitting
I'm in my
right now.
hotel room. So yes, so adenomyosis can produce its own estrogen, like endometriosis. Can you hear me?
Yeah, so much
Yes,
better.
okay. I'm sorry about that.
That's
Yeah,
okay.
and so adenomyosis is not same as endometrial tissue invading muscular layer of uterus, but it is very unique, aggressive, and locally invasive tissue, and that is adenomyosis. So I just want to, clarify this definition first. And I'm sorry, what was one of the question, Kimberly, you shared with me?
Is hysterectomy the best option for someone with adenomyosis, fibroids, and stage 4 endo?
Um, Endometriosis doesn't have any cure, but adenomyosis has cure. So cure is hysterectomy. So once you remove your entire uterus, adenomyosis cannot come back. So that is a difference from endo and adenomyosis. But the hysterectomy is not only option. So that's kind of like I want to emphasize to my adeno patient, endo patient, is you have a choice. If you have a diffuse severe bad adenomyosis, like Anna has, so many patients is only receiving only one sentence. That sentence is hysterectomy. But that is not really true. You can save your save your uterus from diffuse adenomyosis if your doctor knows how to do this. So there's option. So I always present the option to my patient to, yes, you can have a hysterectomy, but if you want to have a baby, if you want to save your uterus, there's way to save your uterus. I don't know if I answered to the questions.
Yeah, no. That's a good question. So, this particular question was saying that she's consulted with surgeons and most have said hysterectomy or egg collection first so they know if it's worth saving her uterus. Would you do an egg collection first?
No.
I guess it depends on the surgeon and their skill, right?
Right. And also depends on if patient has endometriosis or not. If she has endometriosis, then egg retrieval actually stimulate endometriosis to grow, and her endo become much worse after the egg retrieval. So I recommend my patient to clean up your endo if you are going through egg retrieval, but that's a separate issue from adenomyosis. But yeah.
Would you mind telling us more about the procedure, the surgery with Anna? I'm very intrigued.
Yes. So basically, I developed my adenomyosis excision technique, and adeno is like it's even much more than endo. You really, really need to feel the tissue. Without touching the adeno tissue, you cannot really see adenomyosis from outside. You can only feel the adeno, and because Anna's uterus look completely normal on the outside. It is just so big.
It's just large.
Yes, that's right. Right. So if you look at the uterus, just looking at only then it looks like just a big uterus. You cannot even see the bump of fibroid. All of adenomyosis is completely hidden inside of this big balloon.
Yes.
Do you understand me? So only way really detect layer after layer of adenomyosis is my hand. My right hand, I have done adenomyosis excision probably close to 1,000 cases in my life. And my right hand knows exact texture of adenomyosis. Difference between adenofibrotic tissue adenomyosis have a many different type of texture. So I'm feeling adeno texture layer by layer. Then I am slicing, and adenomyosis. Then I use the normal uterine myometrium tissue. In the end, try to repair the tissue. So I put the stitch like a 5 different layer stitch to recreate her uterus.
So it's like a uterus reconstruction.
Yes, exactly. And that each uterine reconstruction, you have to put the stitch inside, stitch into the myometrium, stitch into the tissue. You must feel the tissue.
Yeah, so can you
Without feeling the
explain to
tissue,
everyone, how do you feel it during your laparoscopy? When you say feel, obviously you're holding tools. You're
yes.
holding the tools.
So I developed about a total of 5 different type of technique to remove adenomyosis. So depends on what type of adenomyosis, I use different technique. So some adenomyosis, I can use my instrument. So it's like a chopstick, you know. Even though you're not touching the tissue, if you use some instrument, you can feel the texture of the tissue. That's haptic. So I can detect adenomyosis. I can slice, and I can put a stitch. And some of them I can do laparoscopy. But the case like Anna's case, it's number one, it is so big. There's no space inside. So I still put my laparoscopy to take a look at the big picture of uterus. And I can find the endometriosis, some endo here and there. So whatever that I can access by the laparoscopy, I can target the endometriosis. I can hit the endometriosis. I can remove the endometriosis. But this adeno is like a big monster. So in this case, I need to make some incision line. And it's more like a finesse to mini laparotomy type of incision line. Then using
Like a
this incision
C-section?
line, similar to C-section, but yeah, it's a little bit smaller than C-section line.
Okay.
Then I can literally touch the tissue of uterus, adenomyosis.
Right.
Then my left hand knows, very unique texture of adeno. So I slice. That's why I remove over 120 pieces of adenomyosis from Anna's uterus.
Wow.
I shared a
120.
picture with her. You have a complete set of picture, right, Anna?
Yeah.
Yes, I gave to you.
I
So
posted on the social media.
How big
And
were
so,
these? How big were these like, I don't know, lesions? How big were they?
biggest size of adeno is the size of my fist.
It was
Oh,
like a baked potato. It looked like a baked potato.
oh my
Yes.
goodness. And it was hard? It was
It's
fibrotic?
hard. It's like a concrete hard.
So
It's like a rock.
oh my goodness.
And because of adenomyosis is so invasive, and it's similar to endometriosis. Endometriosis is inflammatory, invasive. It's creating so much scar tissue, fibrotic tissue. So adenomyosis also creating so much fibrotic tissue inside her Anna's uterus. So not only I need to remove adeno, I need to remove associated fibrotic tissue surrounding adenomyosis. So that's another reason why, some doctor using Da Vinci robot, they can try to remove adenomyosis. Maybe they can remove some visible adenomyosis, but whatever the area behind the adeno is unhealthy fibrotic tissue. And that is almost undetectable if you cannot touch it.
Wow. So you have to really
this
feel the
very,
texture.
it's very delicate, sensitive touch. That is only way to attack this disease and to save your uterus. So reason why I know this is I have done so many cases. So I learned that each different texture of adenomyosis.
Yeah.
Then many of my patients become pregnant and deliver a baby even. So you can save your uterus. There's hope. And
There's hope.
Yes, there's hope.
Sounds like it was so painful. Oh my gosh. And the actual the procedure sounds massive. I mean, huge
Yeah.
recovery process, everything.
I'm so exhausted at the end of the surgery.
Oh, how long did it take you? I was gonna ask you that. How long does it
I don't remember 5, 6 hours easily. Sometimes 7 hours. Yes.
Wow. So you're there for 7 hours.
I'm standing and right next to her. I'm touching her body. I'm touching her adeno, and I'm literally creating new uterus.
Yeah, wow. That
I
is,
have Dr. K, you said that I have like 60, around 60, 70 stitches in my uterus.
Yes. Yes.
Yep.
so
Yeah. So, but if this makes my patient much healthier and option to have a baby and option to keep the uterus, I really believe it's worth it. It's worth trying.
yeah, wow. And
They,
question with the reconstruction. So let's say the uterus has enlarged, right? We know that the uterus can grow like in pregnancy. It sounds like it's doing a similar thing when you have that much adeno in there. And then once you remove all of that, so you're left with enough tissue to create a normal size uterus, or is she going to need to go in again and do a part two to this to do more?
No, that's where a haptic technique is coming in. So by haptic technique, I am removing unhealthy, not only adeno, but the unhealthy tissue. So I can tell the difference, healthy myometrium and the disease, fibrotic, disease uterine tissue. So my technique is I'm going to remove up to the line of how to say in English? I'm sorry, I forgot my English word.
It's okay.
like
The border?
It's different from fibroid, fibroid, yeah, myomectomy. So you have a fibroid. Fibroid is like very round texture, like this, and there's discrete boundary.
Border, yeah.
So yeah, borderline, yes. So you can easily find the fibroid boundary. Even using a Da Vinci robot, you can do this. But the adenomyosis, there's no discrete boundary. It looks like a continuous tissue, almost to the outside of the uterus. Yeah. So only when I can really detect healthy and unhealthy tissue is by my touch. Then I cut up to there. Then I can regrab the tissue, unhealthy one, and I can literally recreate new uterus to the shape of a normal uterus. I don't know if this makes sense to you.
It's mind-blowing, really.
It's kind of difficult to explain, but once you see it, you can understand. But
I'm trying to show here. I don't know if it's visible, but
yep, I can see that.
yes,
that they can understand. This is that's what he says. Like this, it's not like a fiber. It's like very irregular. The shapes, very irregular.
And you can kind of see internal hemorrhage of each adeno tissue. There's some hemorrhagic component. They are actively hemorrhaging inside muscular layer of the uterus.
Awful and painful.
And it is creating its own estrogen.
Yeah, wow.
So it's crazy. Yeah. There's no wonder, you are suffering so much. And that's why I was so impressed by Anna. She's an athlete, bodybuilder. And if you really know how big her uterus, this is amazing. Like if she can even survive after this one.
Wow.
And so she must be a great fighter.
Oh,
yes, that's my uterus. Yes.
Yeah.
So
that was the comparison.
So you can see hitting on the spine and going above the umbilicus.
Wow.
Exactly. Like this is my belly button. My belly button was around here, and like it literally felt like that. I could actually, when I was walking, sometimes or running, I will get this like they call it butt lightning in the endo community.
I get that. Yeah.
My goodness! Like the butt lightning is so real. It's like you're walking, all of a sudden it's like this shooting pain, like a sciatic pain, maybe, I don't know. but it just stopped me right on my tracks. And I'll start walking slower and slower. Sometimes I don't know if that happens to other people, but in my case, at least I'll be like, for example, cooking in the kitchen or talking to somebody normally, and all of a sudden I get like a out of the blue stabbing pain, like if somebody just stabbed me in my back, and I'll be like, ah, like what the heck? And then yeah, no, horrible. And all the symptoms that I got, I'll be like normal, and all of a sudden I get like similar to a vagal. I'm not sure the pronunciation.
Yeah, you feel like you're gonna faint or something?
That feeling, but in my case, it was like, yeah, like something here, like went vroom, and then all of a sudden I felt like it, like that, like when you get scared driving, and all of a sudden you're like, oh shit. But that kind of feeling, and then I started shaking for I don't know what reason, and I started shaking, and it lasted around 2-3 minutes. I'll time it. I had to time it, check, and I had a watch. I had to buy a watch actually 2 years ago, because when I was training, I got a heart event, kind of like it wasn't like a full blown or anything heart attack, but it was like a myocarditis. So my troponins went higher than I should have had them. And I had to be in the ER. They had to put me all the things and the patches. And after that, I had to step down for a little bit. And it was probably of the anemia that I was having, and I didn't know. So I had to step down, and we started then tracking everything. I started tracking my sleep patterns. I started tracking my heart rate, and started finding ways more through breath work, and trying to be a little bit more conscious with the timing of my training. Like low training days and then higher training. So it couldn't be like hard. So I started all of those little details and paying attention to actually getting my sleep, my hours of sleep. Because before I was like, if I slept 4 hours, if I slept 5 hours, 6, or whatever, I'll just keep going. But when you have a chronic illness, especially what I was going through at the time, it was so much stress. Because the thing is, like, for me, being active is my fuel. Like I need to stay active. That's what I do. And not being active was more stressful for me. So even on the days that I felt so bad that I didn't even want to step out of the bed, I'll make myself step out of the bed, because I knew I would feel so much better after I got a little sweat or some type of movement. So just knowing that, I didn't want it to be really. I didn't want it to be on pills all the time, or these other hormone suppressors other doctors wanted to give me, injections and stuff. And I was like, you know what? Nope, thank you. I'll go to my diet. I'll go to my workouts. I'll go to my supplements or my tea or whatever. Yeah. And I'd rather go to the safe route, because I know whatever's natural, it comes from whatever we can do, take sunlight, like, so socialize with people that have around the same mindset, of people that give you energy, don't take away your energy all the time. So I know that even though I was training and I was too tired, I know that I'll feel so much better anyways if I continue doing the things that give me. And actually, one doctor told me, a neurologist that I was going before my surgeries before, he was telling me, like, you know what? Just keep doing exactly what you're doing. Keep eating the same way. Keep training. Keep doing whatever you're doing, because today, if this appointment could have been totally different if you weren't doing the things you are doing. Because in my family, there's a lot of stuff. There've been cancer. There've been lupus. There've been fibromyalgia, rheumatoid arthritis, diabetes. Like, in my family, there's like a lot of stuff going on. So it's like you just keep doing that. You might seem like you're bad, but you could be so much worse if you stop doing exactly the same thing you're doing. So that's my best advice to any girl that's going through what I'm going. I know how hard it is. I know how much, you might think like, why is it worth it? Why keep doing it? But you know what? We're still here. There's still things we can do to manage. It's just finding the right person that listens to you, listens to your symptoms, you and your family, your close ones. Let them know what you're going through. Send them information so that they understand your condition. They can be more of a support to you. Sometimes they don't they might not be as supportive because they don't understand. So it is our kind of like not our duty, but us that are actually going through this, and we've gotten some type of answers to keep spreading that forward, that awareness, which is what we're trying to do today with you, Kimberly, and Dr. K here. We're trying to spread that awareness to us into like, what's the right definition for what we have? What are the tools that we have out there to to seek and find some type of relief, and how can we help others, like when I started sharing all of this through surgery journey, because I stopped posting like for 2 years. I started like, I didn't even want to use my social media because my energy was totally only for what I had to do in the day. I needed to cook, stand up, and go do my trainings for my family, and the social media was draining whatever I had left of my energy at some point. So I was like, I really need to go and pay attention to me and what I need, what my body needs, so that I could actually heal, and then I can actually help more people again. Because if you're broken, you can't help nobody. So that's kind of like what I wanted to do. And thank you. I found Dr. K and he's giving me some of the energy back, because actually I bled so much when I was going through adenomyosis. That's one other thing that I didn't want to forget to touch on the live. Some girls ask me a lot about the periods, because there's not that much information sometimes for us, because it's like a taboo, not many people want to talk about those things. They find it like yucky or whatever, but you need to let people know. Like, for example, me and my family, like my husband or whatever, I start but it's not the same thing that you tell them I don't feel good, and they see you that you don't feel good, and they're like, oh, it doesn't feel good. But when you start being more graphic in regards to, like, let them into the movie that you're going through every day, show them, look, this is my period, this is what I'm going through, this is my pain. No, be descriptive about your feeling. Don't just say, oh, I just don't feel good. Be descriptive. When you go to the doctor's appointment, be descriptive. That helps people get a little better idea of what you might be going through, and they might be more key, because they feel included into your journey, into your pain, and they want to help you even further, versus you just say, I just don't feel good, I don't feel like going to that, or I just want to be by myself. Doesn't tell them much. They don't know how to help you. You're just locking the door, and you're making it worse for yourself, because you're locking the door and then nobody can go and help you. So we really need to be more open about it, and if you see something is not right with your periods, take pictures. Like, it's by seeing weird or gross, but literally is the only way a doctor can actually understand what you're talking about, because it's not the same thing, because the perception of everybody is different of things. Somebody might say, oh, I have really heavy bleeding, and when you see the pad, for example, it might be like a spotting for me, and vice versa. Even though you might have two patients with adenomyosis and heavy bleeding, my bleeding might not be the same one as her. Exactly. So I don't know, like another thing that with the adenomyosis, that's very indicative, is like the blood clots, like the heavy blood clots, like they got like this big. They look like a jelly beans, but like really, really
They
huge.
look like little kidneys. I remember, because I have that too. They look like little kidneys.
Yeah, I got one last time, and I was like, it isn't miscarriage, because I could even the shape was weird, and I was like, oh my god, I didn't even know what to do. I felt all of a sudden you feel like, oh, like it's weird, because it plays with your feelings, this disease, because you're like, oh, am I pregnant? Oh no, oh, it's just a bad period again, because sometimes you don't know what's going on, and you get a little bit of glimpse, oh, maybe I can get pregnant, and then it's like, oh no, it's just my heavy periods again.
Yes. And when I was at my worst, I don't know if you see this in clinic, or you hear women talk about it, or if they know that they're passing this, but I passed this, it was called a decidual cast.
Oh,
it was the entire lining of my uterus that had like come out in one thing, and it was like literally the cast of my uterus and my cervix. It looked like, it was mind blowing. I was like, what is this thing?
I've seen them in I've seen images of that because I started searching for it when I got my really heavy clots, and I saw the tissue come out. It's like really impressive when you see the cast come out. It's like, yeah.
Yes.
And not many women. That's the thing. Like before, when I was younger, a teenager, or whatever, I didn't know what luteal phase was, what ovulation phase or whatever. It's just I was just like, I don't know. I got my period when I got it, and whatever. And you're not well informed about how your own body works, why your own cycle is a very important thing to pay attention. Us as women, we have to go through it. So if we understood, and doctors might explain that a little better since you're younger, it might lead to better understanding and getting things to be noticed on time. Because, for
Sure.
example,
So
like
know what normal is. Yeah.
Exactly. And in my case, if they would have ordered an MRI a lot of years earlier, they probably would have been able to detect some of this before it got this bad. And nobody told me, yeah, let's go do a full, a pelvic abdominal MRI with contrast, no contrast, to actually have that comparison, and they didn't give it to me. If they would have, skip all these hurdles they make you of this useless tests in between, so much money we have to waste.
Yes.
Some women don't even have insurance either, so it's like it's a really hard road to go through.
And on that,
you can detect adenomyosis, before MRI. Just transvaginal ultrasound. If your doctor knows how to detect adeno by transvaginal ultrasound, you don't even need an MRI. You can detect adenomyosis fairly quickly like this.
And that's great, because I'd love to finish off with these. We've got 4 questions to answer. And Dr. K, one of them was, are there any specific advancements in imaging, such as ultrasounds or MRI, or diagnostic techniques that have improved the detection of adeno in recent years? So yeah, as you were saying, if someone knows how to detect it, a transvaginal ultrasound can be very effective.
Yes, because there is a very unique spiking pattern of adenomyosis. How does it look like by the ultrasound? So MRI is very, very useful. I like MRI for adenomyosis, especially anatt-sized uterus. It's so humongous, so big. So you cannot really see everything by the ultrasound. So I like to combine imaging of my own transvaginal ultrasound with MRI disc. And then I can kind of like visualize 3-dimensionally how much adeno is anterior component, how much adeno is posterior component, how much more on the left side, how much more on the right side. Before my surgery, I can kind of visualize, all of this location of adenomyosis. Then I need to strategize how to attack adenomyosis during my surgery, because each adeno patient is totally different, totally unique. So I need to, one of the challenges, Anna's adeno is so big, so humongous in every directions. So it's very difficult to really attack where I need to start. But I figure out some, pathway to cut and, to how to attack them and, evict from high uterus. So, but anyway, strategizing is very important.
Yes, and there's another question here. So regarding the surgery you had, Anna, Dr. K, how long does it take for the uterus to heal after a surgery like that?
Each case is different. So after the surgery, I would tell my patient, for your case, but the minimum I would say takes 2 months, 2 to sometimes 3 months.
Yeah. I mean, even from excision surgery, like you don't really kind of feel good until about, that 6-week turning point. It's like, imagine that entire uterus reconstruction. Like, yeah. I mean,
entire uterus going to be created by the stitch. The stitch needs to be dissolved, and the muscle to muscle layer coming together like this, going to be, form the new tissue and the new muscular connections. So it's like a whole process.
Oh, it sounds so powerful and incredible. Have you had a period yet, Anna? You've had a period?
Yes, I actually this because I'm still, the body's adjusting. This is all new to the body. So I got two periods this month.
Oh, wow.
Yeah, I got I think around 2 weeks after surgery, or like a week and a half after my surgery, I got my first period. And normally with the periods, I get like hip, leg pain down to my feet. And I get inguinal pain too. I got pain around my pubic bone. So yeah, I got it all. But the first period was like a little bit because I was confused. I was like, is this still post surgery? But I noticed it wasn't post surgery because the spotting that I got after surgery, it was more like watery, like what you would do, like light spotting when you're about to begin your period. So it's just like a really watery. And then it had stopped, and then all of a sudden it started being more red and more gelish, like consistency. And I was like, okay. And then I started clotting a little bit and more red. And I was like, okay, this is definitely the period. I started tracking. I've always been tracking my with an app. I have been tracking my periods for a long time. Even all my symptoms, I wrote down. Even the weirdest symptom that I think it might not be related, I wrote it in this thing. And I was like, okay, because literally it's the only way you can actually see the chart around those symptoms. And that's how I started telling the doctors, like, okay, this symptom that I have, that I bleed or I get ear pain, I get pain all around this area. And sometimes they correlate with close to my periods, or the migraine started around those times, and the backstabbing, the leg lightning, back lightning.
Yeah.
So that's the only way, girls, you can actually keep a track of what's going on and correlate if it's coming from your fluctuations within your hormonal, shifts around the period. So,
Dr. K, a couple questions for you. How is,
Yes.
and I think we touched on this briefly already, how is adeno diagnosed? As you mentioned, we can use imaging. And why is it often overlooked in women's healthcare?
Good question. Why? I think this is my personal opinion. OBGYN doctor that just doesn't know adenomyosis. It's just like a lack of education, lack of knowledge, lack of research, and endo is more receiving attention compared to adenomyosis. But adenomyosis, today I did a very difficult surgery case. She has adenomyosis, stage 3 to stage 4 deep nodular endometriosis. And this is very interesting. How adenomyosis is more like a posterior aspect of the uterus. Then continuation of adenomyosis is deep nodular endometriosis. So they are together, like there's no separation. So adenomyosis is invading, of course, inside uterus, but also extension of adenomyosis is actually rectovaginal septum endometriosis, which I dissected to the deepest root of the disease, and I completely opened up the space. Then there is a lots of chocolate cyst I discover inside adenomyosis.
Oh,
adenomyosis creates chocolate cyst.
Oh,
And it's very painful.
Yeah.
So this is crazy disease, but this is how important we need to recognize adenomyosis. We need to recognize deep nodular DIE endometriosis. These are all combined together, like almost like one group.
Yeah, so so is the chocolate cyst that you say occur in adeno, is that the same as the chocolate cyst you'd see in like an endometrioma?
Yeah, exactly. Same texture, same type of fluid. So as soon as I cut into adenomyosis, I find that, by my haptic technique, then I find the texture is different. It's not so hard. All of a sudden, texture changes. So I know there's something there. And as soon as I cut and open, boom, chocolate cyst was splashing.
Oh, wow.
There's so much pressure inside.
Yeah, wow. So, from pathologically, the endo and the adeno look very similar.
I'm not the pathologist, but endometriosis produces its own estrogen. Endometriosis is resistant to progesterone. Adenomyosis is also same. Adenomyosis can produce its own estrogen. So it's really very similar tissue. I don't know exactly identical or not, but they behave completely same way.
Yeah, I was looking at a couple slides, like microscopic slides. They both got like the glands and the stroma, and
Right.
but they
And
present
the
obviously.
fibrotic tissue.
Yeah.
So very important is adeno is so reactively making lots of reaction inside the muscular layer of the uterus. So that's why adeno texture is like a concrete, so hard.
Wow.
I was
And
gonna
so
ask you,
today's
Doctor.
surgery, my scissor, after cutting adeno, my scissor become so dull. I have to change scissor 3 times.
It's
gosh.
blunting.
My scissor is losing fight against adenomyosis.
Wow.
It
Question
is so
for
hard,
you.
like a
Yeah, that
cutting a
sounds
rock.
crazy. That sounds
Wow.
crazy. And one more from like a purely medical perspective, Dr. K. Another question is, what
Yeah.
advice would you give to women who suspect they have adeno but feel dismissed by their doctor?
Feel dismissed by doctor.
Find a new
Okay,
one. Find a new doctor. You need to
the
find
advice.
someone. Yeah.
Yeah. So please, because adeno, either your doctor knows adeno or not. So you cannot really educate your doctor from the patient. You cannot teach them. If they don't really know, they don't know. So adeno experience is so important. If you talk to me 20 years ago, or even 15 years ago, I would say I am not experienced as I am right now. So, it's very important doctor doctor saw so many adeno patients, doctor touched so many adeno cases. So their hands know each unique texture of adenomyosis, and experience is most important. So if you are dismissed by your doctor, then yes, I agree, you need to find a new doctor.
Yeah, find someone who knows.
Somebody who knows, yes.
Yes.
Exactly.
Anna, there's a question for you.
And somebody who can give option. It's very easy to tell adeno patient you need a hysterectomy. This is only message adeno patient is keep receiving in the community. But you need to find a doctor who can tell the patient choice. Not only hysterectomy, I can save your uterus.
Yeah.
Not only focal adenomyosis, I can save your uterus from diffuse adenomyosis, and I can create new uterus, and you can carry your baby.
Yeah, wow. See, when I had my surgery done, I was just told, oh, you have a big and bulky adenomyotic uterus, but we're not touching it. And I'm glad they didn't, like, because at the time in 2012, there was no other option for me at the time. They only did hysterectomies. So I'm glad they left it. But, I was given the diagnosis. And yeah, if thank God I'm not very symptomatic these days. But if I were to become very symptomatic, I would know what to look for in terms of medical treatment.
Exactly.
Uterus sparing haptic adeno excision.
Yeah,
Such a long thing. Yeah.
So I can tell you too, in order to save uterus from diffuse adenomyosis, only way is haptic. So if you do no haptic way, it is impossible. I'm just telling you the fact. You cannot save your uterus, from diffuse adenomyosis by non-haptic way, like a Da Vinci robot. But if your surgeon knows really how to touch and feel, how to put this together, you can save your uterus.
It's fascinating. Really fascinating. Anna, there's a question here for you. And it's just, how did you say you tracked all the symptoms again? Did you use an app or were you just writing them down?
Yes, I have a app. I think it's App Tracker. I can verify that for you right away. Yeah, it's P Tracker. Sorry.
Yes, I use P Tracker.
P Tracker.
Also.
Use P Tracker?
Yes.
I've been using that. Like,
For a long
For
time.
many years, yeah, for a
Me
long
too.
time. But once a symptom at the beginning, I didn't take it too seriously. But as symptoms started getting weird, I was like, okay, let me add a new symptom, add a new symptom, add a new symptom, and my list have gotten so big now. But literally, was the best way that I could actually, and you can put what you're feeling, and it has the little notes area where you can write down so you don't forget, because this is the thing, sometimes we feel some things, but if we don't write it down, by the time we have our next doctor appointment, we forget. And then sometimes those little details help somebody like Dr. K that actually knows what they're looking for. They'll be able to tie in, the whole thing together and put it together. Doctors that don't know, they'll be like, oh, you're obsessing, you're how do they call people that are always obsessing about diseases and stuff? Hypochondriac, is it? They'll look at you like that. So yeah, if you can get P Tracker or another app that tracks your period, even the Garmin, the watches now also have an area where you can. But I still like better the P Track because it's a lot more detail and it gives you the charts, and you can actually see year after year the whole chart, and that's the better way to even see the progress or regression of things.
I agree. I like the app. It's an old one, but it's a good one. And
it's
just
a very good one.
Just a couple more things before we wrap up. Earlier in our conversation, Anna, you talked about the first procedure you had done. And we have a comment from someone here saying perhaps it was a myomectomy via hysteroscopy route. She's also from Puerto Rico, and they did the same thing to her. They did first the DNC via hysteroscopy, and then when taking out fibroid, and then the pathology came back with adenomyosis as it was encapsulated. We do not have specialized surgeons here. So that's very insightful. So perhaps you had a very similar procedure,
exactly. Yeah, I think it might have been actually that doctor that did that surgery when I went to that person before Dr. K, because I needed some things for the insurance. When I went, she told me like I am not anymore taking any endometriosis cases. Just like I cannot deal with something like the disease is so complex of endometriosis and adenomyosis that she's like, I totally took it out of my list of things that I do, and I do not attend patients like that anymore. So it was really saddened to hear, because it's a lot less people that actually even want to try to deal with patients like us. So and that's one of the things, you really need to find somebody that has years of experience and also has treated a lot of patients. One of the things that stood up to me from Dr. K when I was speaking to him and asking him all these questions, he seemed very, very assertive and positive about what he was saying, what he was expressing. I felt so sure when I was hearing him, and I had gone to a lot of doctors before, but I had this sense of like, I'm in good hands. Somehow I know that I'm going to be in good hands, because this man that's talking to me right now, he knows what he's going to do to me. And he's dealt with hard cases, and he's not lying to me. He's telling me, you're a hard case, but, we're going to do what we can. But if it's a possibility, I'm going to try to save your uterus. If not, well, then I already knew the other options. So really be very willing to listen and pay attention to details and all those things. And whenever you go to doctors, go with your list of questions too, so that you don't forget any little details. Because sometimes when you're there, it happened to me before, I'll get so overwhelmed, I'll start crying or whatever, and that's tell me something that I didn't want to hear, and at that point I just shut the doors in my mind, and I'm like, it's like you're there and you're not there anymore. You don't want to listen to anything the doctor's telling you anymore, so you tune out. So avoiding that happening, always go with your plan, with your file, your app tracker, your charts. It's like, okay, this is the case. And even though sometimes that you have the case, they probably won't listen to you, which happens too. So, but don't get discouraged. Keep trying to search for answer. We are our best advocates. Nobody knows what we're going through. Nobody knows what lifestyle we're going through. So but also be very realistic, which is what I tell all the people. You have to be very realistic with what is it that I am doing that might be worsening my symptoms. you know, pretty much every chronic disease is going to be caused by either lack of movement. So a smaller percentage of the diseases are caused by genetic problems. The other percentage is caused by epigenetics. You know, it's like what you surround yourself with, what you eat, where you are, your environment. Are there toxins around you? Are you using a lot of cosmetic, perfumes, cleaners? You know, all the array of weird things that we have nowadays that we don't need. So it's like just try to really go back to basics. You know, that's what I'm trying to do in my life right at the moment. It's like trying to go back to basics and keep the basics, like, because they can give you all the pills in the world, they can give you all the best treatments, the doctor can tell you there's this new invasive treatment or not, but if you don't do the basics, if you don't do your diet, if you don't take responsibility of your own body, your own life, nobody's gonna do it for you. There's not gonna be anything put in a silver plate for you. You need to take action. You need to take charge of your own life, of your own health, and start being diligent with what you're putting into your body, you know, the best way possible. I don't mean also like be a soldier and and do everything by the book. We're human, you know, we do things weirdly, but come back to center, you know, from time to time. Just try to do the best that you can so that you can get the best outcome from this doctor's appointment. And then they don't use the excuse of like, oh, but you're not eating well, or maybe you're a little overweight, maybe that's why you have the belly, you know, like if you're doing the things you have to do and you already have been taking care of your own body, your own self, it's easier for doctors to pinpoint what might be the link that's causing your symptoms to get worse.
Thank you, Anna. Yeah, thank you so much for sharing your story and, you know, being such a, like, ladies in the chat have said like so much admiration for you and what you've gone through. So thank you so much for sharing.
You.
Dr. K, is there anything that you'd like to like conclude with, or a message that you'd like to say to everyone before we wrap up?
Yes. So basically, I'm just repeating the same message again because I already mentioned to you. There is a choice. So it's only one-way street. We used to receive actually two ways. If you have a diffuse adenomyosis, you are treated by hormonally medical treatment, progesterone, or any type of hormonal manipulation. That's one treatment. Then another treatment is you are offered to have a hysterectomy, and nothing in between. But that's not really true anymore. You have a choice. So you have another choice. If you want to become pregnant, you can become pregnant, and you can save your uterus, and you can remove your adenomyosis and create a new uterus, just like happened to Anna. So these options are available. So please be educated. Your education is, again, so important. If Anna doesn't know there's another choice, she never come to me, she might be end up with hysterectomy somewhere else.
Mm-hmm.
But
No,
Sorry, you're cutting out.
educated herself, and somehow she connected to my Instagram, and that's so important. So that's using my Instagram, social media to spread all of the correct information. So you are well prepared, well equipped, so you can make your best decision making for your own life. So that's my comment.
Excellent. And Anna, anything you'd like to just conclude with before we wrap up?
No, I was gonna tell everybody, like also like you know, like Dr. K says, like adenomyosis, the only definite cure for adenomyosis, not the endo outside, is hysterectomy. I knew that, but in my case, particularly, my goal was like I still wanted to try to save my uterus no matter what. I wanted for things to be my choice if I could have or not have children, not somebody else tell me that I can. So if that was a choice, I wanted to try to pursue it if there's a possibility. And also, our uterus have an anatomical also position in our bodies too. Everything in our body is there for a reason too. So I'm not in an age yet, I'm not in a menopause age or anything. So it's like if I can still have a choice and I can still have my anatomy, how God intended it to be at the moment, whatever, I'm gonna try to the best of my capabilities. And Dr. K gave me that choice. But obviously, if you're not somebody if you're suffering like me, like I was, that bad or worse for adenomyosis, and it's not, you already have children, it's not in your interest to have children. Don't torture yourself either. Like you always do the best, what's best for you, and you cannot be judged by anybody because you took the hysterectomy route or not. So just know that you have choices. So just keep searching and educate yourself, like Dr. K said.
Yes.
Yeah, there's just one more patient I have recently. She had a 3 IVF and she failed all of IVF. And her IVF doctor basically told her, you have to give up. You have to give up thinking of having a baby. And you need a hysterectomy. You cannot survive. There's no other way. Impossible, impossible, impossible. Such a negative message. Then she came to me, and I know she's not as difficult as Anna's case, but she has a diffuse adenomyosis everywhere. So I gave her the hope. I gave her the option. I gave her the choice. So she decided to save her uterus. I removed diffuse adenomyosis, created a new uterus. Then she became pregnant and she had a baby. So
Wow.
it's happened
good.
naturally without IVF.
So good.
So her IVF doctor is completely shocked because of he said this is unreal, this is miracle. But the miracle does happen. So
And it does.
please
It's like
believe.
when
Please
you
believe
restore.
you have a potential. You can save your uterus. Adenomyosis is not your death sentence, okay? And you can revive.
Yes, and it's like
you
when you
can
restore
have a
the
baby.
when you restore the body, like obviously that's what you're doing, Dr. K, in your surgeries. You're restoring your body back
Yes,
to its original, its
restoration.
default. Yes, and then it just
Yeah,
works how it's
recreate,
supposed
restart, restore, and recreate, restart. I forgot one more word. Reset,
Restore.
restart.
Yes.
So you can start a new life.
Yes. We had a message here saying, wish we had more surgeons like you, Dr. K. Very insightful. Thank you. And one more saying, thank you so much for giving us hope. So thank you so much, everybody, for joining us. And if you're watching on replay, I hope that you found this extremely insightful and inspirational, because I certainly did. Thank you, Anna. Thank you, Dr. K. It's been such a pleasure.
And also, I want to apologize one thing. My description of adenomyosis excision and, creating a new uterus surgery is very difficult to describe. So, I couldn't explain well. I'm sorry, but it is very, very touchy.
Complex.
Very delicate.
Oh, I mean, it sounds like it's something that you have mastered, and that, verbalizing the procedure and the process is something that would be challenging for everyone. It's something that
you cannot put into several sentences. So,
yeah.
but that's my apology. Sorry.
Someone's just said, I have an appointment with Dr. K in exactly 3 months. I'm so excited. Someone's just said, thank you so much, Anna and Dr. K. So yes.
Thank you so much.
Thank you. Thank you.
We are here to fight with you, and this is our fight together. We need to fight. Don't give up.
Anna, your story's been incredible to follow. I'm following like closely. So please, I know you say you're tired from posting on social media, but every time you post, I'm like, oh, it's so exciting to see.
Thank you. I'm trying, and I'm trying to use this. Like I was saying, this has been a downtime because I had to literally. I mean, I was downtime when I was trying to get surgery because I couldn't already do much. But now I'm trying to use this recovery from surgery time to rethink what I really wanted to do. And now I just kept asking God, to give me light my way,
Yeah.
and to find my purpose. And sometimes you think your purpose might be something, and life tells you you have it here, you had it all your life. It's been with you all your life, and what better way to actually being able to help a lot of women that might be going quietly in the shadows with this, trying to fight and trying to be seen, which is the worst part of it, being felt alone and trying to feel like it's like if you're a little box here dark and you're trying to like reach out. It's like, see me, hear me, I'm here, I'm going through this, and
Yeah.
nobody helps you,
And
and wait,
we've got a message from Jody here who says, my 16-year-old likes following your updates too, Anna. She actually had surgery in Canada 6 weeks ago. She's
oh,
also an athlete, and she was spending 10 times a month in the hospital. So you and Dr. K give her hope. She follows you on Instagram. So
oh, thank
that's
you so much.
beautiful.
Yes, I remember her case. Wow. I hope she's recovering well. She's a beautiful girl and she's gonna get out of this.
Yeah. Awesome. Well, thank you so much, everybody. Thank you for another wonderful event, Anna and Dr. K. I hope, you have a wonderful evening. Thank you so much again, everyone, for being flexible with our last minute time change tonight. But yeah, it's been great. So I'll send this replay out shortly, and yeah, take care. Have a wonderful evening.
Thank you, everybody.
Bye. Take care. God bless.
Bye.
See ya.